Role of beta blockers in anxiety. Role of beta blockers in anxiety. We know that autonomic symptoms of anxiety like tachycardia, palpitation, raise in blood pressure, tremors, sweating, and all these symptoms are autonomic symptoms, means because of there is a sympathetic stimulation. Sympathetic nervous system will get activated or stimulated, and because of that the tachycardia, palpitation, blood pressure raised, tremors, and sweating. So, how these beta blockers are beneficial in these autonomic symptoms? Beta blocker reduce these autonomic symptoms by blocking the sympathetic stimulation. It will block the sympathetic system and sympathetic stimulation by acting on beta 1 and beta 2 receptors. It reduces the symptoms, autonomic symptoms, by blocking sympathetic stimulation by acting on beta 1 and beta 2 receptors. So first of all, non-selective beta blocker in the form of propranolol. We use the brand name Ciplar 10 mg, 20, 30 and 40 mg for the anxiety. So propranolol is a non-selective beta blocker in patients with autonomic symptoms of anxiety. Means tremors are beta 2 mediated, palpitation, raised blood pressure, tachycardia, sweating is a beta 1 receptor mediated. So these are the autonomic symptoms of anxiety. So basically it is a non-selective beta blocker. That means it will going to act on beta 1 and beta 2 receptor. So it will inhibit or it will reduce all these symptoms. So it is useful in anxiety inducing states like public speaking, public appearance, or stage daring or stage performance anxiety. It means anxiety during interviews, viva. So basically it reduces the social phobia. It it is useful in anxiety inducing states like public appearance or public speaking, stage daring or stage performance anxiety, or anxiety which occur during interviews, vivas. So basically it reduces the social phobia. Can be used as an adjuvant to the benzodiazepine along with diazepam, lorazepam, alprazolam, but it is not useful in other types of anxiety like panic disorders or panic states. Then we have atenolol, which is a selective beta 1 blocker. It is effective in reducing only cardiac symptoms like tachycardia, palpitation, raised blood pressure. So it is not effective in reducing tremors because it is beta 2 mediated, and this atenolol is a selective beta 1 blocker. So it is effective in reducing only cardiac symptoms. It is not effective in reducing tremors because it is beta 2 mediated. So these are the very important role of beta blockers in anxiety.